Hello, everybody. I'm Dr. Sarah, and I'm so glad you're here tonight. This is a topic that I am incredibly passionate about because I see it in almost every woman that I work with. We are here tonight to talk about something that affects your hormones, your mental health, your energy, your digestion, and even your pelvic floor. That's chronic fight or flight. When women are stuck in survival mode, go, 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 high stress, poor sleep, over functioning, undernourishing, the entire hormone system breaks down. And I am beyond thrilled to be joined tonight by someone who brings incredible healing to this equation. Dr. B, he is an expert in osteopathic manipulative treatment. He is the owner of Karma Osteopathic. And together, we want to show you how hormone care and OMT can work together to restore balance, reset your nervous system, and help you feel like you again. Dr. B, hello, hello, hello. Thank you.
Hello, hello.
Can
Thank you
you
for
tell,
having me.
can you tell us a little bit about yourself, please?
Sure, I'd be happy to. So, I'm Dr. Barnum. I'm from New Jersey. I did my medical training at Rowan University in New Jersey. I did a 4-year residency in Fort Worth, Texas. I'm a board certified physician in family medicine and neuromusculoskeletal medicine. And recently, my wife and I moved to Sarasota, Florida, where we opened up our own integrative functional medicine clinic called Karma Osteopathic.
Oh, and we love Karma Osteopathic. You guys are the best. We love Karma
Thank you.
too. We love your wife,
Yes.
Gabby. She's amazing. The whole business is amazing. So we're
Thank
so
you.
thankful to have you on tonight. And ladies, we're going to start by talking about what happens when we're stuck in fight or flight. So, when we're stuck in fight or flight, or what we call sympathetic dominance, our body believes that it's in danger, just like that bear is chasing us. But there really is no threat there. Your brain signals your adrenal glands to release cortisol and adrenaline, which are great for short term survival, right? They're great when that bear is chasing you. But over time, they wreak havoc on your hormones, your metabolism, and your immune system. And here's just a couple of things that start to break down. Progesterone drops, leading to anxiety, PMS, sleep issues. Estrogen becomes erratic, triggering mood swings, heavy periods, inflammation. Thyroid function slows, making you tired, foggy, cold. Blood sugar rises, right? You want that cake. You're gaining weight. Nobody wants that. Digestion slows down, leading us to bloating and constipation and food sensitivities. You're wired but tired, right? You're
Oh, I
inflamed.
like that.
Yeah, wired but tired. You're inflamed but exhausted, right? And you're completely out of sync with your own body. This isn't just stress, this is a full body hormone and nervous system imbalance. And that is why so many women feel like they're unraveling. This affects women from teenagers to menopause and beyond. We're talking teens, 20s, 30s, 40s, 50s, 60s, 70s, and 80s. So, if Dr. B is agreeable, we are going to play a game tonight, okay?
Let's do
And
it.
yes, and this game is called Dr. B, How Can You Help? Okay. And I've prepared a couple of clinical scenarios. These are real women in my practice, but to protect their identity, our cases will all have names, not the real women. And we're going to talk about women that are really living with this chronic fight or flight. And Dr. B is going to tell us how he can help them. Okay. Are you ready?
I'm so ready. Let's do
Okay.
this.
Okay. Case one. Okay. Case one is the burnt out executive. Okay.
Okay.
So
Okay.
she's 42. She's the CEO. I mean, she is a mogul, okay? But she comes to me, she hasn't slept in months. She lives on caffeine. She hasn't had her period in 3 months, which I'm dealing with. She's bloated, she's moody. She says, I don't even know who I am anymore. I'm working together with her, but I said, you know what? I know somebody that I think can really help you. So, Dr. B, what would you do?
Okay. Well, you're going to see some overlap with each of these cases because there's some things that I believe are paramount for every single person you meet. So, first things first is always getting a good history. Pretty much 80% of the time, you can get an important clue through the history. So, first things first, um, there's always going to be some sort of intake where we gather information. So First off, I want to know what affects her in her day to day. Symptoms are the clues. Basically, we don't treat symptoms, but we can use them to guide us towards our root cause. So I want to know what she's going through in a day to day. What does she feel? I, of course, need to know the basic information. I need to know her medical history. I need to know what surgeries. A big one for me that you're going to find is trauma history. Now, when we look at trauma, that doesn't always mean a major car accident. That's what we would call the big T. So, obviously, we have a lot of life-changing episodes that can happen in our life. So anything from a car accident to any kind of inappropriate touch at any age, um, any type of procedure that went haywire, maybe anything where the body went through shock at any stage of your life is something that the limbic system can hold in chronic fight or flight. And that's an important concept to understand is a lot of people will say to me, but that was so long ago. Doesn't matter. The limbic system doesn't discriminate against time. If it was something that put the brain and body through shock, that can still be something that a woman holds on to. So, especially if the events involved a big state of emotional shock on top of physical shock. So, was this burnt out CEO going through anything physically and emotionally traumatic at the same time? So, if so, was there a particular body part equated to that? So if, this CEO was going through a lot of stress at work and she got into a car accident, she could be having repressed trauma stored in her neck area. So no matter what, you put your hands on somebody in their neck and shoulders and it just feels like a bowling ball, just tight. And that can be a big clue. So in approaching a stressed out CEO, I need to know most specifically medical conditions, surgeries, and injury trauma history.
And you bring up a really good point that I also about trauma that I don't think people, especially women, understand. So a
Hmm.
lot of procedures that women go through are not you and anesthesia is not used. Okay.
Right,
This is a
right.
huge thing in women's health. We give men anesthesia for vasectomies.
Oh yeah,
We do a
vasectomy, you name it.
colposcopy on a woman and she's got to tough it out, right?
This is a very under discussed topic and it needs to be addressed. Absolutely.
But that you ring that in with that may not be something that you think is trauma. And maybe let's actually say that this CEO has pelvic discomfort. So, and she had a colposcopy, and that is associated with a stressful and emotional event, right? Because you're like, oh my gosh,
You
I have
got it.
do I have cervical cancer? Like, what is going on? And now she has to have this procedure. She's not getting numbed. You're on the table with your legs up, and it hurts like the heck. And
Sure
you're like,
does.
wow, you're a woman, just deal with it,
Oh
And
yeah,
now here's her. That's so when you get her history, that's what she says.
absolutely. And I'm so glad you brought that up because, you know, I treat pain from a more holistic standpoint, and I can say this without question, women are built tougher than men. But that also creates that stereotype that women should tough it out. Like, oh, they'll be fine. But you're right. We use local anesthesia for vasectomies and, you know, other basic procedures for men. But, you know, for IUD placement, for example, if they're not using lidocaine on the cervix, you should be checking with your OBGYN about that
Yep.
because there are things we can do to prevent the trauma memory. But in the case of a traumatic colposcopy, it's important to acknowledge that, hey, this was something that was a shock to my body. Because the part that a lot of people forget is we have muscles, we have bones, but what surrounds every cell in the entire body is your fascia. FASCIA. Fascia is a whole network in the body where the whole fight or flight network communicates. So, when the pelvis, all the surrounding muscles and connective tissue go through trauma, there's fascia that's communicating with your brain and back saying, "Hey, that wasn't safe. That I need to go into lockdown," which then constricts the pelvic floor at a small circulation level. Those blood vessels are constricting. It's restricting oxygen to that area, and it makes it harder for toxins to flush out. So even years after a colposcopy, if it was traumatic enough, there can still be memory stored in that pelvic floor.
So
So,
what would you do? What are some of the, just give us some examples of like, what would you do for, what are some of the things you can actually physically do for the pelvic floor?
yeah, great question. So, first things first, when we're dealing with more of a physical emotional connection, that's where we want to make sure the body feels safe to be worked on. Because if you just go rough and tough, like say you're doing a high intensity spinal adjustment, if the body still has memory of something unsafe, you need to make the body feel calm and basically get the green light from the brain body connection to go ahead and proceed. So sometimes I might even just start on the base of the skull where the vagus nerve is located, right at C2. And I might just do a gentle myofascial release. So a lot of people don't know that osteopathic physicians are trained in all different types of approaches. So in addition to more spinal adjustments, we call it HVLA, high velocity, low amplitude. We also are trained in gentle myofascial release, craniosacral, lymphatic drainage, stretch based techniques called muscle energy. So it's the one skill with being a physician is knowing what each individual needs based on their history. And our physical exam is very in tune because we can feel under our fingers what's going on. And part of the art with assessing a patient is being able to assess each individual woman and saying, that doesn't feel quite right. And that feels like that's been there for a few years. There's a big difference between acute and chronic, but first things first, you can never go wrong with starting up at the head and relaxing and activating the vagus nerve, which will really help calm the whole body. This is kind of like a good warm up for really anybody. And the vagus nerve goes all the way down to the sacrum. So for women, the craniosacral connection is huge. So, with that being said, if a woman is having a pelvis that feels locked up, first things first is I'll check craniosacral.
Sign me up. Like, sign me up for this. This sounds really, really, really good.
Yeah.
And you said a couple of things that are so important. And I say this every single day in my practice. Everybody is different and every
Hmm.
body is different. What
Yes,
your friend needs or what worked for your friend is not going to work for you. And that is
exactly.
exactly what we do at Lesh. And I know you guys do over at Karma is we give you tailored, personalized healthcare. And it
Definitely.
is, if even if your friend did pelvic floor therapy and it worked wonders for you, that may not be what you need. And that's why
Exactly.
this is the start of this is important to have that history, to have that physical. So we know where everything stems from you.
Definitely.
That leads me
Um,
into the next thing, which it also affects women drastically. And we're going to kind of go back to the younger women, the 20-year-olds, the 30-year-olds, they're still in the prime of their periods and all those things. And we're going to talk about PMS and PMDD because those affect women horrifically. And this
Absolutely.
is about hormones, but it's also about the nervous system reactivity. We know that in PMDD and PMS, so premenstrual syndrome and premenstrual dysphoric disorder, that progesterone drops, cortisol rises. Guess what happens? Inflammation spikes, but the brain becomes more reactive. So these women, these teenagers, right? 20-year-olds, 30-year-olds, 40-year-olds, even if they're still having periods, can feel like a total emotional derailment. Like they are, especially right
Hmm.
before their periods, right? It's a nervous, the nervous system is not regulating the emotions well.
Yes.
So your next patient is a teen with emotional swings. She's 17. Her mom brought her in actually. She's 17. She misses school the week before her period. She has cramps, she has panic attacks. Her mom says she's always overwhelmed that first week, that week before. She can't deal with anything. Her anxiety is high. She's like panicky. What would you do for this girl?
Okay, this is a great example. So, in osteopathic medicine, we always say that mind, body, and spirit are all connected, right? So that means we can't just focus on the physical alone, but we can get a lot of clues from the physical. So basically, same concept as the first case, get the detailed history, figure out where you can start with the general question of where do you feel it in your body? Like where does it doesn't even have to be pain. Do you feel tension? Do you feel pulling? Do you feel spasms? Where do you feel your cramps? So that alone can guide us on where to start. And there's a little acronym I like to use in cases like these. You can think of like a Pop Tart: tenderness, asymmetry, restrictions, and textures. Those are the types of things that I like to feel for when somebody, especially, is dealing with this kind of case where you may not always have pain as an indicator, but the chronic fight or flight, like we talked about. So you can use those clues on the body to figure out where the root cause is coming from. And there may not always be like an aha one spot. That was definitely it. We have to look at the entire body.
And what do you think about, I know you and I have talked about this before, but the anxiety component, right? So that's so often,
Yeah.
we deal with this in perimenopause and menopause too, where women all of a sudden in their 40s get anxiety and depression. But that's coming from something. But this, like,
Yeah.
especially in
Yeah.
our teenage girls, right? Or our young girls in their 20s when this is happening to them, like what can you do from a chronic fight or flight thing that helps with anxiety?
Great question. I think this is a very important topic to discuss because we live in a society where everything is go, go, go. And especially for our teen girls, there's so much pressure, like from every aspect, pressure with social media, image, how am I presenting myself? So there's a lot of repressed emotions as well. So, there's certain stereotypes that women have to act a certain way. And sometimes that's those pressures that are put on women can lead to basically you hold on to that in your body too. So there's a lot of pressure with body image for women. So even like the effect it can have on women when they're told they need to look a certain way or appear a certain way and not you're you need to lose a couple pounds or so and so looks a certain way. I don't look that way. Our bodies listen to that at a subconscious level. So, and when you think about it, especially with the abdomen, when the body doesn't feel safe, it can store fat at an emotional level. So I think I can get some clues when I'm working hands-on, but at the same time, while I'm working, I also have a discussion about emotions. So I want to know there's a few core emotions I always ask about. Of course, happiness is the good end, but the ones we don't talk about: anger, sadness, fear, and shame. So why why is this individual feeling anxious? And a lot of times behind anxiety is a fear component. So I want to kind of get to the roots of that when I'm working on her. I want to know like what where do you feel fear? Like where does this come from? Is there something in the household setting? Are there friends? Or is there something in your day to day where your body feels unsafe or unwell? Because even just having that discussion alone while I'm working on the tissues, you can actually get some very powerful physical emotional releases.
And I mean, you nailed it. Talking about it, giving
Yes,
someone a safe place. So this is
definitely.
we're all about, I'm about that too, the being that safe place. You can tell me anything, and there's
Absolutely.
power in that. And just as you say, like there's that physical tension, right? Like anxiety. Why do we say, oh, I carry my emotions here. You hear people
Yeah,
say that
there's
when they're
truth
getting a
behind that.
massage. Exactly, because it does affect muscle and it does affect this. But releasing that, well, why? So this brings up a good point of why what you do as a physician in OMT is so important compared to just massage, because you are incorporating
Hmm.
all of those other things. You know how
Definitely.
to do the release piece, right? You know how to do that
Yes,
myofascial piece, but you also know how to do all the other pieces and connect them, and you understand that mind
you
body
got it.
connection. And
You
yes, you're
got it.
trained and skilled and helping the vagus nerve and all of these things. You can do all of that too, but you bring so much more to the game because
Absolutely.
of your training. And I think
Yes.
that young women, you want to help them. I would never go back and be a young woman again. I don't care how much you paid me. It is hard, and it
Right?
was hard then, and it's harder in this world. Um, but we can help, right? And a lot of that is good. It's touch, right? It's getting that
Absolutely.
hands-on touch with the client, working on those physical areas, but more importantly, working on that mental area and getting patients in tune with their body, how they feel,
Yes.
why they feel it, and that it's okay to feel it.
Absolutely. I'm so glad you brought that up because there are some people who are literally never taught how to feel what their body's telling them. And when you think about it, you can actually be your most powerful diagnostician. Now, another very important topic to discuss is the medical gaslighting that occurs in the United States. And when women feel something about their body and physicians, especially male physicians, not, I'm going to call them out, especially telling a woman that, no, that's just in your head. No, the gut feeling is always what you acknowledge first because there's something deep in your subconscious that knows something is not right. I always tell, especially my female patients, if you ever feel like if you ever feel worse after leaving a physician's appointment, that physician gave off unsafe energy, or something just did not feel right, then there are so many providers out there who can help. You do not need to keep staying with that person.
And you brought up a great point, which, and you and I have talked about this before, and all of my clients under know this because most of them are coming to me because they were gaslit, right?
Yep.
They're coming to me because they've been working with a physician for 2 years, and both of us are Western medicine trained
We
physicians.
we know how
We-
it is. We
Exactly.
know.
We went through the training. We understand the lack thereof, especially in women's health. But what is so infuriating is, and it does happen to women, male physicians, but female physicians do it too, which
Right.
infuriates me even more because it's like, come on, ladies, like you should know. But you're
Right.
when someone I actually just did a YouTube on how to talk to your doctor. And this was in regards to perimenopause and symptoms, right? Because guess
Hmm.
what? In perimenopause, your labs look normal, right? We know that.
Right.
Like anybody that knows women's health knows their labs look normal. We go on the body. How are you feeling? What are your symptoms? Okay, that's what we treat, right? Because we know the labs are normal. But
Definitely.
we say we know, but they don't know. They get told over and over again, your labs are normal. Here's the gaslighting that happens to women. Well, you're a
Yep.
busy mom. You're working a lot. You have kids. Oh my God, I'm so sick of hearing that.
Oh
And it
my
happens
gosh. It's
day in and day out. And you're
yep.
absolutely right. There, we are here. We will listen. We will deal with your problems. And this is the reason why we're doing this, right? This is the reason
Definitely.
why I met you. I believe in everything you do. You're powerful. You have an amazing business. But we need to get this word out, right? We need to tell women,
Absolutely.
everybody. But right now we're focusing on women that the power
Right.
is with them. And that's
Right.
exactly why I just did that YouTube about how to talk to your doctor, right? If they tell you your labs are normal. And I use keywords like, I understand
Mm.
my labs look normal. How about we talk about my symptoms and where they're coming from? And giving
Yes.
powerful strategies to women to be able to empower them for their physician. Because hopefully you would be able to find one, but we're getting better, but sometimes you can't, right? And you may need to go, it's hard to find doctors, and to go to three or five is not the, ideal.
Right.
But that actually brings us into the next part of what I want to ask you about, which is also very powerful because when we do, we're going to bring it back to the perimenopausal, menopausal woman. But
Hmm.
when everybody hears of, oh, hot flashes, night sweats, everybody knows that, right?
Oh yes.
One of the things people do not know that occurs all the time in perimenopause and menopause is joint pain. Okay.
Yes.
When that
Yes.
estrogen drops, again, that cortisol goes up because remember, they're on the same axis, right? So that FSH
Correct.
is what whips that ovary to produce the estrogen. And when we become
Definitely.
estrogen deficient, the FSH is climbing and it's whipping that ovary, and the ovary is saying no, like or it's giving a little bit. Well, guess what
Right.
it does? It goes to the adrenal gland and it says, "Hey, yo, you got any estrogen?" And it goes, "Well, I don't got estrogen, but I got like cortisol. You want that?" And
I love
so
this
then
description.
right, and then the cortisol goes up. Now we have inflammation, which is also why we get midsection fat. But what else
Yep.
does inflammation do? It causes joint pain.
You got it.
Joint pain is one of the top complaints of women in their 40s. Back pain, hip pain, stiffness, like what do I have? Arthritis, like all of this stuff. It's
Right.
hormonal, it's inflammatory, and it's structured. So guess
Absolutely.
what? Your next patient is the CrossFitter with hip pain. Okay. So
All
she's
right.
45, she's strong, she's active, but she's like, my hips hurt, my back is constantly hurting. Hey, guess what? She went to like four different orthopedists who did all this imaging, and they're like, nothing's wrong with you. Your images look good. Your x-ray is fine.
Yep.
I don't know.
And
And then she even said, I do CrossFit, I work out, but like I'm recovering slower. And I'm like,
yes,
you know what? I got the guy for you.
I love this. No, the these are cases I see all the time, and I'm so glad you brought this up. What a lot of people don't know about chronic pain or chronic fight or flight, what it comes down to is circulation. So, a lot of reasons people don't heal in a specific site is we're not getting enough blood flow in. When I'm talking about blood flow in, I mean you're getting good warm oxygen to your tissues and flushing toxins like lactic acid out of the site. If you have that constant flow, it's very rare that sites are going to break down chronically. And you can kind of see this in somebody who's very active and maybe they're a little bit sore and then a day or two goes by and it's like it never happened. But then you have other people who try to work out and then they're in pain for weeks. That is not normal. That is a clue that something's going on. Now, here's the problem though, where most people feel stuck is that chronic fight or flight can happen in isolated areas in the body. So this kind of goes back to some of the topics we hashed on is the trauma history, sites where the body went through shock. This is something I talk about in my practice every day. I like to use the phrase interference. So, anywhere, any location in the body that went through any particular type of shock, think of it as like an electrical force field. That fight or flight nervous system, it has no concept of time and it doesn't follow logic. All it knows that is that at some point it went through shock. It could have been a week ago, it could have been when you were a kid, but let's say this CrossFitter was a college athlete who pulled her right groin. And so at some point, she went through acute inflammation for the first 3 months, and then it turned chronic. And after 6 months, it's more ropey, it's more pulling, it's dull, it's nagging. And there's a subconscious memory of, oh God, I better not overdo it or I might pull it again. Whether she consciously remembers it. And then 20 years go by, and she says, I say to her, any traumas I should know about? And she said, no, nothing. And then we're doing a osteopathic exam, and I go right up to the hips and the left hip, nothing. I could compress it, I can press on it. She's like, nope, just feels like pressure. And then I go to the right groin, and she goes, oh wow, oh my gosh, what was that? And that's when you kind of say, did anything happen here? Like, and then sometimes I have to prompt it, like, and he pulled muscles. Oh, yeah, by the way, as a matter of fact, this is where, as you start diving in with a patient, you're not always going to remember all your traumas. Like, I could give you an intake form and you may complete half the list. But that's the thing, the brain and its fight or flight is hardwired to protect those distant trauma memories. So it is physically too much glucose exerted and expended to remember all your traumas. So kind of like the movie Inside Out, where the subconscious is like a stored vault, your brain is going to subconsciously store these old injuries. So that's where you can get a lot by seeing an osteopathic physician because you can uncover and peel those layers of the onion where the trauma's been stored. So in the case of this CrossFitter, willing to bet that there's some sort of pelvic asymmetry, possibly one leg shorter than the other. It's going to be around the lumbar, the sacrum, and the pelvis. And I guarantee you we're going to find some stored tension. So we can combine any techniques necessary where I can get the joints articulated where I'm springing the joints into better motion. We can stretch out the lumbar, sacrum, and pelvis. We can do craniosacral. We can, if we need to do any spinal alignment, we can do that. But yeah, we can uncover a lot in literally just getting the history in one body session.
And one thing really, really cool is that again, we go back to that being in tune to your own body, right? And there's something so powerful with that. And people are not a lot of the time.
They're not taught how to.
Exactly. But it's also looked down on, right? You're like, oh my God, I'm crazy, or do I really feel that?
Definitely.
I don't. And one of the things that I do with my clients when they start working with me for weight loss, actually, is they'll come in and they'll be like, okay, what diet am I on, and what am I doing, and all this. Da, 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 da. I'm like, actually, the first month you're doing absolutely nothing, and they're like,
Yeah.
what? What? And I'm like, no, no, I want you to listen to your body. How is this affecting you? What is changing? Because if once we begin to understand our body
Yes.
and how we feel, we can make permanent change. And I think this is true in this case, right? Because she has a couple of compounding things, which all of these patients do. They have a medical aspect that I have to treat as well. As an
Right.
integrative medicine doc, right? Like if this girl is going through perimenopause and her estrogen drops, that's a part of this, right? I got to fix that too. But in succession with that, I need you to get all of those systems back in alignment to put her body back in check. And also when
That's right.
that is done, right? When you work on the vagus nerve, when you open up the pelvis and increase blood flow, right? From a myofascial
You got it.
perspective, everything else gets back in alignment. And yeah, she may still be estrogen deficient and we'll work on that, but she will be more responsive to what she already has in the
Oh,
body.
absolutely. We can enhance the body's natural healing mechanisms without depending on excessive amounts of pharmaceuticals or invasive procedures.
Yeah.
Let's
And
oh, go ahead.
that's awesome. And that actually takes us to our next girls, because this we're talking about procedures and talking about stress and talking about chronic fight or flight. Now we're going back to our 20 and 30-year olds who are one of the most heartbreaking things that I actually see
Yes.
in the practice, which is women that are struggling to conceive and they're being told you have unexplained fertility.
Right.
And a lot of times when we step back from that, what we find out is that they're living in chronic fight or flight. And
Exactly.
and that body, just like you said, that body, they store and it protects. What we find out is that body is smart, right? And
So
when
smart.
there is a trauma, guess what the body does? It shuts down and it says, "Oh, we're not
Hmm.
safe." So if we're not safe, we're not going to let you get pregnant, right?
Exactly.
And then guess what it does? Again, we said it increases inflammation. Well, what does cortisol do? It suppresses ovulation. It depletes
Absolutely.
progesterone. And guess what it also does? It disrupts the communication between your brain and your ovaries. And here's one thing that you said that hits us right on the money. It makes the uterus less receptive by reducing blood flow and
Yes.
increasing inflammation. And for me, and I'm sure you work with a lot of patients like this, the hardest part for me is that these women are doing they think they're
Oh
doing
my God,
everything
yes.
right. They're eating clean. They're taking supplements. They show up for their
Hmm.
appointments, but their body is stuck in survival, right?
You got it.
So what
It-
are we going to do for these ladies? Like what can we do?
Yeah,
I think this is
exactly.
powerful.
Yeah, we got to continue the mental, physical, spiritual approach and, optimize everything physical first. So continue everything that they're still doing with the appropriate diet, exercise, and then basically go through their medications or supplements. Could there be anything there? Go with everything else from lifestyle, any kind of hormone disruptors. Are they using like too much perfume? Are they using certain linens or detergents or anything that could be disrupting her hormones? That all still is very important. But the way I approach a lot of body work, sometimes I have to stop and tell myself it should not have to be this much work for this woman to just have a normal pregnancy. Like in a default setting, this body should be hardwired to feel safe to have a healthy pregnancy. So where is the biggest holdup? But if there is something anatomical structural that could be affecting the organ health, that's something we can work on as an osteopathic physician.
Yeah, and that like I think that that's really powerful. And also for the women to understand and know that they're in control of that, right? Like they have the ability to go to someone like you and have you work on their pelvis or work on C2, right? The vagus nerve is in control of everything. And it's such a time that you feel so just discouraged and like, oh my gosh, nothing is working. Again, having that hands
Definitely.
on, right? Having that person say like what is going on and having those discussions and then realigning everything. Lifestyle is a huge
Definitely.
part. It's a part of every single case that we discussed. It cannot be put on the back burner, right? It's in
Right.
addition to. These are in addition to all of the rest of those things. And
Absolutely.
the last case that I want your opinion on is going to be now we're going to back to this end of the spectrum, right? And we're going to talk about the old lady who got gaslit and never got put on hormone therapy because her physician
Yep.
said it causes breast cancer. And this is honestly one of the most serious and underrated consequences of hormonal decline in women that occur after menopause, which is bone loss, right?
Yes.
We know that estrogen plays a key role in maintaining bone density. When it drops, women become osteopenic or, gosh, forbid,
Yes.
osteoporotic. And then you add on chronic stress, low vitamin D, poor absorption, undernourishment. And sometimes this isn't
Yep.
found until too late. And
That's right.
unfortunately, because of the gaslighting that went on with the Women's Initiative study that came out and said, hormone therapy causes cancer, breast cancer, which it doesn't. That study wasn't even looked at correctly, and that's for a
Ah,
later date. But some of these women that we're dealing with now, guess what? It's too late. So,
right.
and now they have a hip fracture, right? And after a fracture, the goal isn't just healing, but what is it? It's restoring
Right.
mobility, it's reducing pain, it's improving balance, calming that overall nervous system. And remember, these women in this time of their life, when they get a hip fracture, like we're talking about just being able to get them back to a point where they can get off the toilet, right?
Yes.
Can get
Oh,
into a
yes.
car. They can carry their groceries. We're not talking about that CrossFitter anymore. We're
No.
talking about
So different.
daily activities, right?
Oh,
So,
yes.
so our last case is a 68-year-old who had a low impact fall at home, fractured her hip. She's recovering from surgery well, but she feels stiff, off balance. She's obviously anxious, right? Because she's anxious about this happening again. She's frustrated, she's in pain, she's scared to move, has history of insomnia, chronic stress, right? Fight or flight. Oh,
Right.
and by the way, she was gaslit, so she never was offered
Oh,
hormone
shocker.
therapy. So that's why she probably has or contributed to the fact that she has this hip fracture. So, what can you do for her?
Absolutely. Well, first things first, they're going to be under an amazing physician like Dr. Sarah, who's going to be optimizing everything, making sure her calcium and vitamin D levels are appropriate, um, making sure that she's supplementing and maximizing all that absorption as much as possible to make sure that another major fracture doesn't happen or reduce chances as much as possible. And then, if said patient comes to see me, what we're going to be working on is basically making the body feel safe to return to movement. So, have you ever had a patient who, they've tried physical therapy, but it just hurts? I mean, who hasn't been there? Like, my physical therapist was saying, like, come on, can you do this exercise? And they say, no, like, I don't, it hurt too much, or my body felt too nervous to do that because it might fracture again. That's my fear. So with OMT, the way I like to describe it, it's like taking a hands-on body approach to make the basically give the green light for the brain body connection to feel safe. So what I tell people is my treatments are not a substitute for getting out there and doing good exercise and movement, but I can help make the body feel safe to do so. So what I'm going to be doing in the office setting, elderly patients are tough. A lot of people think like we got to be fragile, we can't touch them, they shouldn't be exercising. That is so far from the truth. Those muscles that are not used are not magically just going to regenerate over time. We have to prevent atrophy and muscular deconditioning, especially in our 65 and up community. So with patients, especially ages 60 and up, I will be doing more joint mobilization. So that can sometimes be having a patient lying flat on their back and basically getting the hip moving in different directions. And we're not going to force it. We're going to go with what level is comfortable for her. And we're going to We're going to move the hips in different directions. This is where I might start adding more spinal work, like gentle stretching, getting mobility. I may be using my hands to loosen up adhesions around the muscles and tissues and the spine. And basically, I'm going to be using TART. I'm going to be checking those tender, asymmetric, restricted, and textured sites, and basically get the body moving. So I want to make it so that when I may write a physical therapy referral, and she'll feel ready and excited to go do so. So it's a teamwork approach between me, Dr. Sarah, physical therapy. We got to get this patient moving and feeling safe.
And this is the patient at the end of our spectrum, right? Because our really goal is to not have patients ever get here because
Right.
we're going to be able to intervene in their 30s and 40s, and we're going to be able to talk to them about real stuff. We're going to be able to get them on supplements. We're going to be able to get them on hormones if they need it. They're not going to be gaslight, and they're going to be strength training, right? Because what
Yes.
strength
Yes.
training is platinum for the bone. And we say this, my clients know
Yes.
this, it is a non-negotiable,
You
ladies.
got it. Oh my God. I was
Strength
just saying that
training
today.
is a non-negotiable. And
It is.
again, we're not talking about Arnold Schwarzenegger, right? We're
That's always the
talking,
stereotype. Yep.
I know, but we're talking about getting off the toilet. We're talking
Yes.
about getting in a car. We're talking about functional ways, and string training
Yep.
is one of the ways. Like it's not gold, it is platinum.
It
And so
is.
that is part of our passion, right? Is that we're going to help those that unfortunately the system didn't help and that got lost, unfortunately.
Yep.
But our real goal is to try to prevent that from ever happening again or to anyone else that works with us.
Right.
That is our passion and our mission in life. And honestly, this is what real medicine looks like. You just saw it here. Okay.
You got
What
it.
we've shared tonight is what we believe medicine should be. It's integrative, it's collaborative, it's restorative. You are not meant to live in a state of burnout, inflammation, and hormone chaos. And no, just like Dr. B said, it is not in your head. It is not in your head. We know that when we treat the whole woman, we treat her hormones, her nervous system, her structure, and most importantly, and he said this time and time again, her story, then we
Yep.
know that's when
Yep.
we see true healing. This is why
Absolutely.
we do what we do. This is why I collaborate with physicians like Dr. B, because women need more than prescriptions and patchwork. They need
Absolutely.
care that actually honors their complexity and supports their healing. So here's the shout out, right? If something here resonated with you tonight, if you saw yourself in any of those stories, we want to invite you. We also want to beg you to please, 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 please reach out to us because we can help. And Dr. B, tell us how we can contact you, how we can get an appointment, how can we get in touch with you?
Absolutely. Absolutely. Start off with a Google search of Karma Osteopathic. Karma named after our cute little 2.5-year-old puppy. You can call us, text us at 941-529-6750. You can email us, heal@karmaosteopathic.com, or you can search us on social medias, Karma Osteopathic, Instagram, LinkedIn, Facebook. And it's my practice is me, my wife Gabby, and my puppy. So we're very accessible. We're very hands-on with our patients. You can also go to karmaosteopathic.com. We have a new patient inquiry form, and then any patient that comes to see us or anybody who's interested, we offer free consultations. So I do free 30 to 40-minute consultation calls, and that way I can hear more about your story and give suggestions and kind of come up with a skeleton idea for a treatment plan. And then I all my intake form is done digitally, so I want to know all about you before you even walk in the room, and I study everything you fill out the day before, so that way all my patient encounters are exclusively hands-on, so we can get right to business.
This is awesome. I please, please, please reach out. We will also put all of their information in the show notes. They are an amazing practice. Also, we want to put a shout out follow, subscribe, right, for more information. follow them on Instagram because they all put out some amazing topics and some awesome, awesome, awesome content. Also, for us, you can follow us on Instagram at lesh.life.style. You can email us at info@leshlifestyle.com. You can follow our YouTube channel. You can call us 941-202-2324. We'll always answer. And listen, the end result is this. You deserve to feel well, whole, and in control of your health again. And we are both here and ready for you when you are ready. Dr.
Absolutely.
B, listen, I thank you. I thank you. I thank you from the bottom of my heart for being here with us tonight. And as always, ladies, until next time, what does I say? Stay well.